Abuse is a challenge for communities across Wisconsin, but today Wisconsin's top attorney was in La Crosse to hear about the effects of increased drug abuse on the county. News 8's Sarah Tamer tells us there's a new challenge for law enforcement and county officials. Sarah?
Lisa, the lack of treatment facilities in the area is a big concern for Crosse County officials. They spoke to the Wisconsin Attorney General this morning about how local jails are constantly filling up with people who need to be receiving treatment for addiction. And right now, the county doesn't have the funding or the resources to help.
There's a lot of big issues that, one group isn't going to solve. It's going to take a lot of people, throughout the whole criminal justice system.
Officials from all over the county can agree on one thing. A drug problem exists, but enough places to find a solution for that problem simply don't.
Understanding the importance of coupling, not only punitive measures, but also treatment measures, and how we come together to have those conversations about what is that right balance.
La Crosse Police Chief Ron Tischer says they've looked at recent arrests and there is a large number of people who want to get treatment right away. But law enforcement officers are struggling to find treatment facilities, whether it be publicly or privately funded.
If we don't get them treatment right away, we seem to be in this revolving door of constantly them using drugs, getting arrested, getting in the criminal justice system, and they never break that cycle.
Tischer says the community is noticing the need for facilities, but there is pushback on where those facilities would be built and how much funding they would need. It's not a problem exclusive to La Crosse. Wisconsin Attorney Brad Schimmel says drug addiction is a familiar story statewide, but there are efforts from the state government to address the needs.
They are investing in encouraging more people to get into alcohol and other drug abuse treatment, in getting more medication-assisted treatment available, having the medication-assisted drugs available, but then also having providers that are capable of doing that. They have done a lot to make that more available.
The Attorney General also says the community needs to start dealing with addiction like we deal with diabetes, cancer, or any other disease to encourage people to get healthy.
Yeah, now treatment facilities seem to be a big concern, but there are some other factors contributing to this as well.
The AG says it's hard to get local hospitals or just hospitals across the state to work on this because it takes a lot of funding and a lot of hours for people who are providing the treatment. And he says, traditionally speaking, people in that area haven't always been paid well enough. He also says another area that we need to start working on is prevention because we want to tackle the addiction before it becomes a problem.